Good morning, everyone. My name is Joseph Filippi, Executive Assistant for the Nevada Division of Public and Behavioral Health. It is 9 a.m. on Friday, September 10th. Before we start the State Board of Health meeting, I just want to remind everyone, if you're joining by computer or by phone, please mute yourself. We will have an opportunity for public comment later on in the meeting. And I will go ahead and start taking roll call so that we make sure a majority of the State Board of Health members are present. So starting out, Dr. John Pinnell, are you present?
Present.
Thank you. And Mr. Smith?
Present.
Judith Bittner?
Present.
Thank you. Monica Ponce? Okay. Dr. Morosky?
Present.
Thank you. And Dr. Larson? Okay. So we do have a majority of members. 4 out of the 6 are present. So I will hand over the meeting to Dr. John Pinnell, the chair, to start today's State Board of Health meeting.
Good morning, and thank you, Mr. Filippi. Welcome, everyone. Today's meeting was posted in accordance with Nevada's open meeting laws and regulations. We'll go right to our action item, consideration and possible adoption of proposed emergency statement and emergency regulations amending Nevada Administrative Code, NAC Chapter 441A, relating to COVID-19 vaccinations for state employees and state contractors working in state-operated licensed healthcare settings or state-operated detention facilities. Mr. Rowski, or Mr. Filippi, I'll let you introduce who's going to be testifying on behalf of the state.
Thank you, Dr. Pinnell. Joseph Filippi for the record. I believe we have Dwayne Young from the governor's office today, as well as our deputy director at Department of Health and Human Services, Candace McDaniel, available.
Good morning, everyone. My name is Dwayne Young, and I serve as policy director for the Office of Governor Sisolak. It is my pleasure to stand here before you today. With me today is Department of Health and Human Services Deputy Director and Special COVID Liaison to the Governor's Office, Candace McDaniel. Ms. McDaniel will walk us through the MAT recommendations that led to this, and then I will take us through the policies and also the reasons as to why we're here today. We also have, who is attempting to join us, having some technical difficulties, Dr. Assad, who serves on the medical advisory team that specially advises the governor on these issues. And so with that, I will turn it over to Ms. McDaniel.
Thank you, Mr. Young. At the request of Governor Sisolak, on August the 5th, the governor's medical advisory team recommended that employees who work with and who serve vulnerable populations or are employed in congregate care settings to become fully vaccinated for COVID-19 and then show that proof of vaccination to their employer. The goal of this recommendation is to increase COVID-19 vaccination for those who work with vulnerable populations, including those in high-risk occupations and high-risk settings, in order to really protect those who are served by these systems. Mr. Young?
As we get into the policy, I want you to understand that the governor's office has affirmed its obligation to protect those entrusted in their care within institutional settings. Many of us who, when we signed up to be state servants, we took an oath and a vow to serve those who could not and did not have a voice or the ability to protect and serve themselves. And so with that, we are bringing forth a requirement that all Department of Health and Human Services employees, contractors, or transfers who enter an institution for vulnerable populations within the normal scope of their employment, as well as Department of Corrections employees, must receive all necessary doses of the COVID-19 vaccine to become fully vaccinated on or before November 1st, 2021. Understand that this has ramifications beyond the policy of just protecting staff, but also protecting those that were in care. This policy will also require new hires to be vaccinated prior to their start date. This policy will allow for medical exemptions, as we know that there are individuals whose medical physicians have advised them not to take the COVID-19 vaccination. This will just simply require verification of that. We also know that there are individuals with closely held religious beliefs. While many religious institutions and leaders of varying faiths have come forward and said that the COVID-19 vaccine is part of their religious and moral duty, we know that there are some with closely held beliefs that object to this. And so there will be exemptions for those individuals who are outside of those religions that have already come forward, saying that this is an acceptable practice and in good faith for their fellow man. And understand that also, in light of President Biden's announcement yesterday on federal vaccination mandates for Medicaid and Medicare providers, with certain requirements of participation, most of, if not all, the DHHS facilities, with the exception of those which are forensic in nature, will be captured under this requirement because of their Medicaid and Medicare billing relationship. I want to talk to you about the reality of how we arrived at this. Of the 18 correctional facilities across Nevada, as of yesterday, 4,533 inmates have contracted COVID-19 infections. Also, 1,104 staff members have also contracted COVID-19. Deaths within this setting include 49 inmates and 3 staff. The current overall vaccination percentages of the Department of Corrections is 43% vaccinated, 57% unvaccinated. I want to stop and pause and thank Director Daniels for his leadership and his vision in this area, proactively trying and standing up and recognizing that it is us and our responsibility who protect the inmates that don't leave. This also has a cost to the state of $9.2 million in overtime since the course of the pandemic to cover the shifts of those officers who have been infected by COVID-19. The most significant epidemiological code for COVID infections occurred between October 2020 and January of 2021. Unfortunately, we are seeing another wave of COVID now, and we are back to where we were in December with hospitalizations increasing and bed capacity decreasing. We obviously don't want to repeat the winter of 2020, but given this trend, if we don't take swift action, we are facing that direction. In the 2 state-run forensic psychiatric hospitals, 95% of the infections have been from the staff of these facilities. Again, an obligation to protect those that we are entrusted to our care. And within the Division of Family Services, with facilities that have shown 62% of COVID infections with staff. And as a reminder, many of these facilities serve children under 12 who cannot be vaccinated. Staff enter and leave every day, whereas the residents stay, often for lengths of stay that anywhere can last from 90 days to 9 months. And so in that conclusion, as I pause for any questions that you have, I understand that this policy has been met with some controversy. I understand that many people feel as if their rights are being imposed on. But what I say is that in order to change the trajectory of our path of state, in order to protect the people that are entrusted to our care, we must take big and bold actions, and we must require mandates for vaccination for those employees who are serving these vulnerable populations. Thank you for your time today.
Thank you, Mr. Young and Ms. McDaniel. I'll go to the Board of Health members first before we go to public comment. If you have any questions for either one of them, please.
Mr. Pennell, it's Dr. Morosky.
Yes, sir.
Hi, Mr. Young, thank you very much for the very well-stated comments and clearly laying out the fundamental reasoning behind why vaccination in this population is so critical given the rates of disease seen. I understand within the MAT framework recommendation, it really spoke to vulnerable populations, and this is clearly a vulnerable population. Beyond the current federal mandates, we think this will be complementary to those requirements that have just been laid out for Medicare and Medicaid providers to help in the healthcare space, and the correction space is very similar to that. Do we see there are further groups that we may need to cover through emergency regulation?
Dwayne Young for the record, and I thank you for this question. And I think we have all struggled and wanted to go bigger and bolder. And so we know under emergency regulations, we have the scope of about 120 days. I was excited by the federal action and think that this will certainly be complementary. At this time, we felt that the scope of our authority within NRS and the request should really be shaped to state employees. To simplify this, my grandmother always taught me, clean your own house before you comment on someone else's. And so we hope by taking this action, it will encourage all of our partners in the private sector to have the courage to take similar actions throughout all types of businesses and organizations in Nevada.
Thank you very much. And we've, as a board, required vaccination for people who work with vulnerable employees for a very long time under Nevada statute. So this is just an expansion given the current situation with a new virus that needs to be addressed through the same mechanism. So thank you. And thank you for the explanation on the emergency regulations. That's very clear.
Thank you, Dr. Morawski and Mr. Young. And just to clarify, Dr. Morawski, at the beginning, when you said we feel this was complimentary, the Board of Health has not met on this before today. And so.
No. Speaking personally, I feel that. Thank you.
Okay, thank you. Other questions, please, from the Board of Health before we go to public comment? Mr. Young, I have a question. I'm always looking for unintended consequences, and I guess we can't prevent all of them, but what if there is a large number of resignations?
Doing Young for the record. And you know, one of the things obviously the government must weigh is that it must be able to perform the services to those public. And so I know that the Department of Health and Human Services, as well as the Department of Corrections, have provided contingency plans for staffing, but if there is mass resignations or people that are asked to leave due to their insubordination, that will certainly affect the operations of the state. I will tell you that the state is examining every power in its toolbox in terms of administrative and legal actions that it can to be able to fill those positions, as well as offer overtime to those individuals who may have to cover. We know that this has been arduous and tenuous. What we have found, the data has found in many other states, while people are upset about it, while they realize that they became a public servant for a reason. They came to serve the public, they came to uphold their duty, and they will eventually, many will eventually comply. And so while they may feel that their personal freedom is encroached, their sense of duty for many individuals, their sense of dedication to the state of Nevada, its residents, its most vulnerable, and let's be honest, its economy, because we don't want to see those budget cuts again. Their sense of duty to that, I believe, will allow them to rise to the occasion and do the right thing.
Thank you, Mr. Young. Any questions, any further questions from the Board of Health? Okay, we'll move on now to public comment. This public comment will be for this agenda item only, which deals with consideration and possible adoption of proposed emergency statement and emergency regulations relating to COVID-19 vaccinations for state employees and state contractors working in state-operated licensed healthcare settings or state-operated detention facilities. I'd like to remind all our callers, we welcome your comments, but this is not a question and answer period. This is a public comment period. Public testimony under this agenda item may be presented by phone, computer, or written comment. Because of time considerations, each caller offering testimony during this period for public comment will be limited to not more than 2 minutes. The Board of Health members have received all written comments up until the start of this meeting, and they're entered into the public record. If you're testifying on your computer, you'll see a countdown clock. If you call by phone, Mr. Philippi will verbally notify you when your time is up. If you continue to testify past your allotted 2-minute time period, your mic will be muted to allow the next person to participate. Use of obscenities or other behavior which disrupts this meeting to the extent that orderly conduct is made impractical may result in the forfeiture of the opportunity to provide public comment or removal from the meeting. Thank you for joining us. Mr. Philippi.
Thank you, Chair Pinnell. Joseph Philippi for the record. I just wanted to make a comment that Dr. Ponce, a member of the State Board of Health, has joined the meeting by phone. She was a little late, but she wanted to make sure that her attendance was reflected in the meeting. With that, we will now start the public comment period related to the emergency draft regulations. If you are wanting to make any public comments regarding these regulations today, will you please raise your hand by using the function in the Zoom meeting if joining by the computer. If you are joining by the phone, you can raise your hand by pressing *9, and then I will call upon you and unmute you, and then have you give your comments. You'll have 2 minutes to give the comments, I do see a couple people have raised their hand. We'll start with Michael RN. I'll go ahead and ask you to unmute yourself and give me 1 minute to share the timer with everyone so that we can make sure it's fair. All right, sir, you do have 2 minutes and you may begin.
Good morning. My name is Michael Long. I'm a registered nurse. I am licensed in the state of Nevada. I apologize. I just came off a night shift working in the ICU in a COVID unit, and I'm very concerned about the position the Board of Health is taking on this matter. I know that it's very succinct, related to specifically the Department of Corrections and the other state entities. My biggest concern is related to those that will resign and those that will leave this position based on their concerns related to whether the health and safety of these vaccinations is in their best interest. In addition to that, I have seen a significant amount of patients being admitted into my ICU that are vaccinated. And I've held the family member's hand when they looked at me in the eyes and said, "Why are they in your ICU? They're vaccinated." And I just look at them and I said, "I'm sorry, they are here and we'll do our best." The reality is we have people that are vaccinated that are coming in COVID positive. They are out there and they don't know. A lot of them are not symptomatic. A lot of them are carrying it and are passing it on. And there isn't any mechanism right now based on this emergency order to be testing those that are vaccinated. It seems very contraindicated to be alienating a very large portion of the employees that are providing care to the needy that should be protected, but we don't know for sure. And you have no mechanism to protect those when you have vaccinated staff that will continue to come into work that can still be spreading it. Thank you.
Thank you, Michael. We'll move on to the next person with their hand raised, Christine Armendariz. You can go ahead and unmute yourself. You have 2 minutes. Christine, are you able to unmute yourself? There you go. You have 2 minutes to begin, ma'am.
Yes, I'm actually Tanya Armendariz. For the record, please. My name is Tanya Armendariz. I'm a correctional officer with the Nevada Department of Corrections, 13 years. I speak for myself. We are in the middle of a pandemic that is, it's affecting all of us in some form, some kind of way. I'm vaccinated. Others are arguing about their body and their rights and are continuing to place all of us, the inmates, the public, myself, I have kids that are unvaccinated because they don't qualify to be vaccinated at this point, I'm sorry. Those who, because of their rights and because of their beliefs, they're supposed to have 2 tests weekly. And I've heard excuses. There were no more appointments left. I wasn't able to go. I'm going on vacation. I have heard so many excuses, and this isn't right. All of the protests and the division, it does not represent all of us. These excuses, it doesn't represent all of us. And right now, my daughter, she was exposed twice to COVID while in school. She's vaccinated, as thank goodness. But my daughters, they're sick. One's at home. She's 9 years old. She can't be vaccinated. I feel that as a corrections officer, I have a duty to these inmates.
Thank you, Ms. Armendariz. Your 2 minutes are up. We appreciate your comments today. We'll move on to Paul Lunkwitz. You can go ahead and unmute yourself, sir. You have 2 minutes.
Hello, can you hear me?
Yes, we can. Good morning.
My name is Paul Lunkwitz. I'm the president of FOP Nevada CO Lodge 21. I submitted comments earlier. I would like to briefly summarize them. Pursuant to the president's address last night, 100 plus employees, you're going to have to test weekly or get vaccinated. And I believe that the tests that have already been happening have been done at the correctional facilities. And I'm speaking about NDOC, where I was an officer for 21 years. This is an inconvenience for people, but we were doing it. We continued to do it. Whether some people have a problem with it now or not, I can't speak on that. But I'd like to comment on the previous gentleman's testimony when he said $9.2 million in overtime. What do you guys think that's going to look like when you lose 57% of your staff? You already have a very hard problem staffing correctional facilities in Nevada, even just when there's not a pandemic, even when there's not a vaccine mandate. It is a drastic issue with staffing. They're already working overtime. People are getting forced mandatory overtime once every other day, a lot of times at High Desert. This is the reality of the situation. Whether you lose 57 or 40 or 38%, people are standing up and they do not want to be forced into something. The alternative of being tested, I'm not sure that that's such a big problem. The way the department had been doing it is where you go in and you get tested on the way into work. I can't see why this is something that has to be mandated and, infringe on people's right to choice of what goes in their body. I submitted more articulate comments. I hope you guys all had a chance to read them. And I stand in opposition to forcing this on us. The legalities of it are going to carry on for years. The expenses of terminating someone and them going through appeals process, all that's an expense that shouldn't be overlooked. Thank you for your time.
Thank you, sir, for your comments. We'll move on to Abby. You can go ahead and unmute yourself. And just a reminder for anyone joining on the phone, if you are wanting to make any public comments, you can raise your hand by pressing *9. We'll go on to Abby, though. You can go ahead and unmute yourself. You have 2 minutes.
Okay, so I'm going to start this off as another state employee with another agency. And I would say with my agency, probably a third of the people are against this vaccine. And to go on with what that gentleman just said, are you willing to lose at least 1/3 of your staff and spend all the money and resources to hire and train new people, inexperienced people? And then study after study on this vaccine has been showing with the Delta variant that those who are vaccinated are contracting Delta variant, they are spreading it around. And then when they're asymptomatic, therefore they're going to work, they are sick. They don't know they're sick and they're giving it to me, they're giving it to anyone else. I'm actually homesick today from work because I have symptoms. I know I'm sick. I called in and said I can't make it. So why should I have to be around a bunch of other people who are asymptomatic and they're spreading it to me when the vaccine actually killed my dad and I'm being punished for it? And then you have nations such as Israel with the highest vaccination rate and their cases are increasing. And now people are concerned with the MU variant. Scientists are saying this evading the vaccine. Why should we be forced to take something that's not even working when it's being evaded? And then the vaccine still emergency use authorized. And I know they say Pfizer is fully approved, but Pfizer, they only approved the community COMIRNATY. Not the vaccine they're giving you. Community will not be available for a few more years. So you're still injecting everybody with a vaccine that's emergency use authorized. And where is the evidence that COVID has ever been truly isolated and the evidence that you can differentiate between each and every strain that you are saying is out there?
Thank you for your comments. We'll move to the caller with the last 4 digits of 8686. You want to press *6 to unmute. Please state and spell your name for the record.
Hi, my name is Kellen, K-E-L-L-E-N, and I work for the Department of Corrections. I am a nurse, and I just want to say that I have actually been in the thick of this with my fellow coworkers in medical for over 2 years. We have been on the front lines. We have come to work every day. We have treated all of the inmates that have actually tested positive for COVID. We have been right there with the staff who have been positive, and I've made personal phone calls to see how they're doing and do status checks. I want to say, as far as my particular facility goes, I have seen a large amount of vaccinated inmates and staff come down with COVID, test positive, have symptoms, spread it around. I don't understand how we have been on the front lines for a couple years now and how they're going to turn around if those of us who don't want to take it for whatever personal reason, whether it be because we're afraid for our own health, how they're going to turn around and thank us for that hard work by saying you're going to get fired if you don't do this. Thank you.
Thank you for your comments. We'll move to Holly Flammer. You can go ahead and unmute yourself. You have 2 minutes.
Hi there, my name is Holly Flammer, and I am a Medicaid provider working in the mental health care field. I was working with individuals, homeless and addicted individuals when COVID first started happening, and I now work with foster care kids. I have been unvaccinated through this entire time period and have also been exposed to COVID at least 10 times and have never gotten it. I have gotten all of the tests. I have gotten repeated antibody tests, and I just don't seem to get this virus. And I have very, very serious religious exemption or religious objections to wanting to get this vaccine. And I don't understand how there are lots of people who don't seem to get this virus for whatever reason. The vaccine is not working in a large part of the population. I personally cannot quit my job. This is my livelihood. I am a PhD, doctorate graduate. I can't just turn away from my entire livelihood and my passion, but I also am scared to death, absolutely shaking in my boots about the potential of having to get this vaccine in order to keep my job and keep helping the people that I do, especially after 2 years of being able to not get this virus. And I've been in locked rooms with children who have had it for over an hour, been in locked cars. I really hope that you guys will make considerations and at the very least, offer medical and religious exemptions for those of us who don't want to do this. Thank you.
Thank you for your comments this morning. As a reminder, if you're wanting to make public comment, joining from the computer, you can use the raise your hand function in the Zoom application, or if you're joining by phone, go ahead and press *9 to raise your hand. We'll move on to the next person. JB MacBook, if you want to go ahead and unmute yourself, state your name for the record. You have 2 minutes.
Hi, can you hear me?
Yes, we can, sir.
All right. My name is Josh Braun, and I've been a correctional officer for the Nevada Department of Corrections for coming up on 10 years now. As an employee for the state of Nevada, myself and all employees around this state have gone through it all, to include our families and children. I only have 2 minutes and more to say, so I'll just mention a few. Understaffing, pay freezes, pay cuts, health insurance getting worse, empty promises of things getting better, and to top it all off, the reason we're all here today, a vaccine mandate. I'm not going to sit here and talk about masks and vaccination because we can all look up facts that support our own beliefs. It's not about that. It's deeper. It's about freedom and the freedom of choice. Men and women in this military have fought for our freedoms, and some have paid the ultimate price. Well, it's our turn now, the citizens of the United States of America, to fight for our freedoms. What we're asking is for that freedom of choice. Freedom to choose to get the vaccine or not to get the vaccine, and for our choices to be respected and not to be discriminated against because of them. Per the directive last night, there is a choice to either receive the vaccine or continue weekly testing. After all that us loyal employees have been through, we're just asking for that choice. One thing I've learned about being a state employee is being able to get a job done with the minimum number of resources available and necessary. Another thing I've learned is that we are all more united than what meets the eye. I understand that I am just a number, but I also understand that all branches of state and local services are already working with the minimal number of employees, and I'm talking pre-COVID. What I want you all to ask yourselves before voting on this is, are you prepared to continue with half the numbers you currently have now? It's not too late. Please make the correct decision. Thank you.
Thank you for your comments this morning. We'll move on to Ian Gallagher. If you want to go ahead and unmute yourself, you have 2 minutes.
Yeah, my name's Ian Gallagher. I am a work from home programmer developer. Basically, I've slowly but surely been kind of ostracized by coworkers, my company. I can't join any events simply because I'm not vaccinated. It's like I'm a black sheep or a plague, although I have not been sick since November of last year. I've been around people that are COVID infected. I at one point had COVID, like I said, back in November of last year. I've thankfully recovered fully. It was a pretty minor ordeal for me. I'm probably in a more not as critical category as far as age and health. And you know, at the bottom line is we can sit here and talk about the virus, the testing, the methods, the vaccine, what ingredients it has, how dangerous it is, whether the vaccine's effective or not, go over the numbers. We can sit here and mull over this for the rest of our lives. The bottom line is there's this thing called, you know, basic human rights. And one of the rights is to our own body, you know, what we put in our own bodies, what we eat, what we drink. That's a human right. We get to choose what to drink, what to eat, when and how. So this is a violation of human rights, forcing people to vaccinate themselves and causing people to, forcing people to have these conversations with their family about whether they're going to have a job, be able to put food on their tables. That's a terrible thing. And I don't think that's good in any way. And I hope you guys can kind of see the nature of how this can look something sort of like what Nazis would do, like they did to mentally ill patients before they start executing Jews. It's a terrible thing. We shouldn't be doing this to our own citizens.
Thank you. We'll move to the caller with the last 4 digits of 4477. If you want to press *6 to unmute yourself, you have 2 minutes.
This is Dr. Naughton, Naughton. I work at NDOC in Carson City, and it would, in a perfect world, it would be great if everybody was vaccinated. We see that people that are vaccinated are getting infected again, but we're at the hospital, both in Reno and Carson City, the hospitals, we're not seeing the people who are vaccinated as sick as the ones who are unvaccinated. Most of the people getting admitted now are unvaccinated, but the problem that I see with mandating vaccination is there's so much resistance to it. I'm afraid our staffing would be even worse than it is now. I would love to see it, everybody vaccinated, because I think it would help. But, you know, forcing people to do things they don't like is never a good thing. So, but it's, again, as I say, people who are unvaccinated are at greater risk for being on a ventilator and dying than those people who are vaccinated, even if they do get reinfected. We've had several reinfected patients at NMCC and the other camps, and so far none of them had to be put on a ventilator or have had any real serious illness like we were seeing when the first big wave went through. But I think it's a decision that has to be taken in account of all of the problems associated with it. right now, what we're doing is we're testing everybody when they come in on their first day of work, and that's not negotiable. And nobody likes to be tested. I don't either, but I think it's the best.
Thank you for your comments, Doctor. We'll move to Mike Dante. You want to go ahead and unmute yourself? You have 2 minutes.
Am I good?
We can hear you.
I've been a correctional officer for the Nevada Department of Corrections for a little over 9 years now. Most of my colleagues already covered everything, but the question comes down to, I know both sides of the spectrum. I have a medical exemption. I'm not allowed to take any vaccines, but I still feel bad for the people that have taken the vaccine and those that can't. At what point in history, at the powers that be, have made a decision where they're going to start busting down people's doors to take a vaccine? That's the question you really got to ask. Like, there's a freedom of choice. I understand both sides of the spectrum, the people that are scared, the people that aren't scared. Goes back and forth, and it's a he said, she said game. It's really just the question you got to ask yourself: what is right and what is wrong? Is it really right to force people to take a vaccine? Just like Lunkwood said, about 75% approximately at High Desert State Prison are not vaccinated. So if they say, okay, you don't have a job anymore, 75% of your workforce is gone. Then that brings up the National Guard's going to have to come in and run the prison. And then that's going to be a mess itself. So threatening a work, if there's 75% of the people that have questions about a vaccine and they're not sure if they want to take it or not, that has to be brought up too. Why aren't people taking it? That's a concern to be talked about. Nothing's perfect. It's like the smallpox vaccine. Everyone that I know in the military that took the vaccine has not gotten smallpox. People who are taking the COVID vaccine are still getting it. So I just leave you with that question. What's really going on with the vaccine, as they so call it?
Thank you for your comments this morning. Again, if you're wanting to make any public comments, please raise your hand through the Zoom application on the computer or press *9 if joining by the phone. Thank you. We'll move to Valerie White. You have 2 minutes.
I am just speaking to oppose any kind of move on this board's part to support mandating vaccinations for any state employees or any individual in the state. It should be obvious to all board members as Americans that mandating this vaccination is unconstitutional. Have they reached out to legal experts to confirm this? It should be obvious to them. If they are moving to mandate this for any employees in the state, then they're just asking, they're acknowledging, I don't respect the Constitution. I don't wish to follow the law of our land. I am going against what this country was founded on. The Constitution has led this country for decades, for centuries. And if they're going to say, yes, we want all state employees to take this vaccination, and we're going to mandate it, they are absolutely spitting on the Constitution, and it's wrong. And if they can't see the difference between the Constitution and some little edict, executive order from a president, in quotes, then they should not be on the board. They should remove themselves and resign. If you can't follow the Constitution, resign. That's all I have to say. Thank you.
Thank you for your comments. If anyone else is wanting to give public comment related to the emergency draft regulations, please raise your hand. If you're joining by the phone, please press *9 to raise your hand. We have Grizzly's note. You want to go ahead and unmute yourself and state your name for the record? You have 2 minutes.
Yes, my name is Tiffany Garcia. I'm a local activist here in Las Vegas, Nevada, Clark County. I wanted to jump up on here really quick, along with the countless other doctors, nurses, and attorneys that are participating today in opposition of this mandate, simply for the fact that it is affecting countless Americans. Countless studies have gone out, and a lot of young children from the age of 12 on forward have passed away due to this. I think for what it's worth, more strategic studies need to be done, but I think forcing the population and our children to get this vaccination is a step in the wrong direction. And I think it's time that the board stands on the Constitution and with the American people and do what's right. That's all I got to say.
Thank you for your comments. I'm not seeing any additional hands raised. So one more time, if you're wanting to make any public comment and joining from the computer, raise your hand in the Zoom application. If you're wanting to make any public comment over the phone, press *9. Ms. White has raised her hand one more time. Ms. White, did you have something to add?
Yes, I would just like to know where I can access this recording to view it, review it later, because I missed part of the meeting. Can you provide the link someplace so that we can see where it will be posted?
Yes, you can email the email that's posted on the agenda, stateboh@health.nv.gov, and request the recording, and we can try to get that to you along with the meeting minutes once they are drafted.
Okay, and is there a 30-day wait for that?
Correct, yes.
That seems really excessive. Why is it so long?
Takes time to transcribe the minutes, ma'am. But go ahead.
Okay, thank you for taking my second.
Thank you. All right, anyone else wishing to make public comment today regarding the emergency regulations, please raise your hand. So I believe, Abby, you've already given your public comment this morning. We'll go ahead and allow anyone who hasn't already spoken to give public comment. All right, Cheryl Johnson, you have 2 minutes. You can go ahead and unmute yourself.
This is really not public comment. It's more of a question. If it is decided that they will be going to go ahead and mandate this for state employees, will they also be accepting the responsibility for any risk that any of the state employees may have as far as side effects, deaths, breakthroughs, any long-term effects of the vaccine that they're forcing us to take? Thank you.
Thank you, Cheryl. Unfortunately, I don't think public comment's meant to be a question and answer opportunity. However, I'll defer to Dr. Pinnell if he wants anyone to address that question. Paul, go ahead, Dr. Pinnell, sorry.
Okay, thank you. When we get on public comment, I might ask the Deputy Attorney General about that, but let's continue public comment first.
Thank you. Paul, I saw your hand was raised again. You have given your comments within the 2 minutes. We're going to have to go to anyone else who hasn't had an opportunity to give their public comments this morning. Please raise your hand. All right, Dr. Pinnell, I'm not seeing anyone else wishing to give public comment.
Thank you. Public comment is now closed. Thanks everyone for participating and expressing your position on this. If Dr. Azam is still on, Dr. Azam at our last Board of Health meeting presented statistics on and percentages of cases in Nevada. Dr. Azam, sorry to put you on the spot. Do you have any idea on the percentage of breakthrough cases in Nevada that are being hospitalized? If you could answer that, please, sir.
Thank you for the question. Aizen Azam, for the records. Most of the people who are hospitalized are unvaccinated. And I just want to mention that the vaccine is 93 to 94% effective. So eventually, out of 200 million individuals who are fully vaccinated, you're talking about 10 million people who are not protected. There is nothing perfect. There's no vaccine that is perfect. So eventually, breakthrough cases are happening, and 10 million or 12 million people who are vaccinated could end up developing the infection. The good news is that if you are fully vaccinated, the vaccine is going to protect you from severe illness and from death. Certainly, not everyone out of the 10 or 12 million people have extremely great health. So while they are vaccinated, they may develop the infection, and this is what is called breakthrough infection, and they may end up in hospital if they are having comorbidities, if they are severely ill previously. So eventually the vaccine is extremely protective, but not for everyone. And we need to know that most of the people in the hospital are not vaccinated. The numbers, the last numbers I heard of was about 95% of the hospitalized individuals are not vaccinated.
Thank you, Dr. Azam.
Thank you.
If one of our deputy attorney generals, you can decide to answer that or not. It has come up on responsibility that the state faces for this. If one of you want to answer, fine. If not, that's just let me know.
This is Julie Slaybaugh, Chief Deputy Attorney General with the Attorney General's Office, representing the Department of Health and Human Services. For the record, I don't believe it's the time to give our legal advice in a public meeting. That would be attorney-client privilege that we will discuss after this meeting with the board and the division and department.
Thank you, Ms. Slaybaugh. Board members have any questions? If not, I would ask for a motion, please, concerning action item NAC 441 relating to COVID-19 vaccinations for state employees and state contractors working in state-operated licensed healthcare settings or state-operated detention facilities.
It's Dr. Morosky. I will motion to approve.
Is there a second?
Judith Bittner, I second that motion.
Okay, it's been moved and seconded to approve. We're now open for discussion among the Board of Health members.
Dr. Pennell, I think Mr. Young and Dr. Azam really outlined clearly the contingency work that's being done to address many of the concerns that were raised on the public side. And I'm sure our attorney generals have more guidance they can provide those departments as those concerns around staffing were raised. And so I don't feel, that's why I was able to motion. I feel that we have a good plan in that space. And I think Dr. Azam laid out clearly the breakthrough infections and the protections that we've had, and that this recommendation is clearly in line with the MAT recommendations in the larger picture, as well as those guidance that have come out from a federal level.
Thank you, Dr. Morosky. Any other comments from board members? Hearing none, I'll call the question. All those in favor, please say aye.
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 All those opposed, please say nay. Any abstentions? Okay, the motion does carry. Thank you. Moving on to public comment for any item. And this would not, any action may not be taken on this matter for general public on this agenda. It's not relating to anything, but we cannot take any action on it. So Joseph, see if there are any hands raised.
Thank you, Dr. Purnell. If there's anyone wishing to give general public comment today, please raise your hand on the computer or press *9 if joining by the phone. I see someone with just says iPhone has raised their hand. I'll go ahead and unmute you. You have 2 minutes. Please state your name for the record.
My name is Chesna Panise.
There's some connection. Sorry, ma'am. There's some connection
Facilities.
issues
Just had a
happening.
question to put out there about natural immunity. Somebody who has already contracted COVID. If somebody who has already had COVID would have to get the shot as well. I just thought it was an additional outlet for people who are hesitant to get the shot. If they've already had COVID, if they would still have to get the shot. That's all. I was just putting that out there for consideration. I don't think you guys can hear me anymore.
Thank you for your comments this morning. We'll move to Valerie White.
Yeah, I just know based on lots of reading that this COVID has, the numbers that you have are based on a PCR test largely, which have been found to be unreliable as they don't singularly identify COVID. And so all your data that you're relying on is questionable from the beginning. The data that you're getting from the federal government, from a CDC where you have Fauci who lies, from an FDA who is unreliable as well. You doctors, you people on the board, you're just continuing the lie that's coming out of DC, out of our captured president. You should resign because you are not representing the people. You're ignoring the fact that there are medications and procedures to help people get over this. So what it just looks like, as long as there's any kind of illness on the planet in this country, that you're going to need to control us, take away our constitutional rights and our freedoms. You need to resign, and you need to put your head on your pillow every night knowing that you're traitors to this country. That's all. Traitors.
Paul, you have 2 minutes. You may begin.
Yeah, by my count, you guys had 2 people that voted yay, and there are 5 board members. So I'm kind of confused as to how the motion carries when you have less than 50% that voted to approve this. Albeit I'm not as familiar with your guys' procedures as normal, but in just about every voting situation, you have to have more than 50% to approve a motion. I'm very confused as to how 2 people can approve this when no one else voted. If you could please explain that, I would very much appreciate it. And also previously, I forgot to mention in my comments, it's in my email comments that I submitted, but we're talking about a quote, vulnerable population that every single one of them was offered the COVID shot, and they had a choice to take that. And now the employees that protect the community are not having that same choice. So if you could please explain the voting, I would really appreciate that. Thank you.
All right. So let's go back. So Dr. Purnell, I heard, I will be honest that I did hear Dr. Purnell, Dr. Morosky, and Mr. Smith motion to approve, Ms. Bittner as well. So I believe that is 4 out of the 6 voting members who did approve. There were no nays. So that is a majority to pass the motion that was approved earlier in the meeting. I hope that answers your question, Paul. But we can move to Michael. You can go ahead and unmute yourself. You have 2 minutes.
Hi, thank you for taking another comment. If it's my understanding, the board has now passed this and forcing this on a significant amount of employees across the state. My concern now is if you're going to have employees left in the state who are now vaccinated, when are you going to start testing them? Because we know that they are carrying, and if they're asymptomatic, you're still bringing that back into vulnerable adults and vulnerable populations. So I feel that there's definitely prudence for there to be testing of any staff that's going to be bringing a potential harm into an establishment. Thank you.
I apologize. I was on mute. Technical difficulty there. So John Gaha, can you please unmute yourself? You have 2 minutes.
Oh, thank you. Sorry, I thought I did something wrong there. I just wanted to say my name is Joni Gajardo. I am a local activist as well. And I just want to remind everyone on the phone here that the survival rate of COVID-19 does exceed the survival rate of the vaccine. So I just want to remind everyone there that you guys did take an oath to protect the people who don't have voices, as you said earlier. So it comes down to, again, doing the right thing. It seems like you all had your minds made up before this call even started, because I want to say that you took an oath to be a puppet. Thank you.
Move to the caller with the last 4 digits, 3491. Please press *6 to unmute yourself. Caller with the last 4 digits, 3491. Please state your name for the record.
Hello, can you hear me?
Yes, we can.
My name is Kelly Evans, and I just wanted to comment. My husband is in the military and has had to deal with this mandate. And the military, he received an email yesterday that they have backtracked because the only vaccine that is available at this point is still experimental. So I hope that gives everybody on this call a little bit of hope that this is still an illegal mandate. Thank you.
Thank you. We'll move to JB. Go ahead and unmute yourself.
I just, can you hear me?
Yes, we can. Go ahead. Sorry.
All right. Once again, thank you for taking my comment. My only question is, are we going to get the option to continual testing for those who choose not to get the vaccine, and or are medical religious exemptions going to be granted? That's my only question. Thank you.
All right. Abby, you want to go ahead and unmute yourself? You have 2 minutes.
I was going to say thanks once again for taking my comment. You guys have the doctors who say that the COVID wards are full of unvaccinated people, but by your own, the CDC's definition of unvaccinated is you can have both vaccines, but unless 14 days have passed, you're considered unvaccinated. So I could have had 2 doses of Pfizer or Moderna 1 week ago. I'm still unvaccinated. I could have had them 13 days ago. I'm still considered unvaccinated. So how many of those people in the hospital, when they are saying unvaccinated, have received both doses of Pfizer or Moderna, or have received the single dose of Johnson & Johnson within the past 14 days, since by the CDC's definition, they are still considered unvaccinated? Why is there no study going on for that? Thank you.
I think the host is muted, but it may be my turn again here. I just want to second that I hope you guys will really consider religious and medical exemptions, especially religious exemptions. I live alone. I don't have a family. If I were to get COVID, I'm not putting anyone at risk. I believe that it is my right fully to decide whether or not I die. And so it's my choice to choose if I get COVID and wind up on a ventilator. I don't think that that option should be taken away from me religiously and spiritually. I just really hope that you guys will put something out about exemptions for those of us who really do want to keep our jobs and who are passionate about helping others, but also do not want to put something like this into our bodies for our own health and religious freedoms. Thank you so much for giving us the opportunity to provide comment.
Thank you for your comments this morning. We'll move to the caller with the last four digits, 3491. Please press *6 to unmute. You have 2 minutes. Caller on the phone with the last four digits, 3491. Press *6 to unmute. All right, not sure if there's any technical difficulties going on. If there's anyone else wishing to make public comment today, please raise your hand on the computer or press *9 on the phone. All right, I'll hand the meeting back over to Chair Pennell. Dr. Pennell.
Thank you. Joseph, I'd like to take a 5-minute recess. The board will reconvene in 5 minutes. It is 10:02. We'll come back at 10:07. Thank you.
All right, so it is 10:07. We're going to go ahead and reconvene the State Board of Health meeting. Let me just make sure we have a majority of the members present. Dr. Pinnell, are you online?
I can't. Yes, I'm here, Joseph.
Okay, perfect. Ms. Judith Bittner?
I'm here.
Thank you. Mr. Charles Smith? To Dr. Morosky?
Present.
Mr. Smith, are you on the line? See you there. We'll go to there you are, Mr. Smith. Can we test your microphone, make sure we can hear you? Can barely.
Yes, can you hear me?
Oh, sorry, not you, John Smith. Sorry, I'm talking to the board member, Charles Smith. Mr. Charles Smith, we can barely hear you, sir. Okay. We will go to Dr. Monica Ponce. I think you're on the phone. Dr. Ponce, can you unmute yourself and let us know you're present? Not hearing from Dr. Ponce, Chair Pinnell, but we do have a majority of the members present, 4 out of the 6. So we do have quorum to go ahead and reconvene.
Thank you, Ms. Philippi. So we'll reconvene the Board of Health meeting. I don't want any confusion on the record on the vote. So I will call a roll call vote. If Joseph could read our names one more time, and please say whether you're for, aye, or nay, or abstain. And the chair votes for, votes aye.
Thank you.
Go ahead and call the rest of the roll, please.
Thank you. Mr. Smith, please let us know your vote. Aye. Ms. Judith Bittner.
Aye.
Ms. Dr. Morosky.
Aye.
We have 4 ayes. Any nays? Hand it over to you, Dr. Pinnell.
Thank you very much. As far as the question on this, this agenda was posted online, and if the questions are coming up about religious or medical exemptions, please read the bill and look at item number 4, and I think that should clarify some of the things. I thank everyone today for your participation. I thank the Board of Health, the state members that were here today, and I will go ahead and adjourn this meeting. Thank you.